New at 6, contact tracing concerns are reaching the state level. A Florida lawmaker is now questioning the state's program after a tracer contacted him following his COVID-19 diagnosis. I-Team investigator Katie LeGrone following these new developments tonight.
I don't wish this on anyone. I call it the yo-yo disease because 1 minute you're fine, and then the next minute you feel like crap.
Florida Representative Chevron Jones hasn't been shy about letting the public know he recently tested positive for COVID-19.
Main symptoms are like a tight chest and stuffy nose and headaches.
But the Broward County Democrat is also making known his disgust with the state's contact tracing program following a call he received last week from a tracer seeking details about his own whereabouts.
The young lady who called, she wasn't knowledgeable at all.
Just a few questions in, Representative Jones says the tracing stopped when the call disconnected.
Maybe they'll give me a call back, but that never happened.
So the phone disconnected and you never got a call back?
No.
And what does that tell you?
That we need a new system.
The representative sharing his frustration in this Twitter post yesterday where he described what happened, adding, "If this is our tracking system, throw all of it in the garbage."
It's really trying to bring light to the issue that if we are serious about ensuring that we're going to save people's lives in this time, that we have to do our part.
With cases surging in the Sunshine State, Florida contact tracing efforts have expanded to 1,500 tracers in recent months. In late May, the state added several hundred more when it quietly contracted with an outside firm. But the increasing number of cases in Florida still far outweighs the number of tracers. Though the state remains tight-lipped about its program, this questionnaire available on the state's website gives a glimpse into how tracers are doing the job, asking patients where they were tested to the types of contacts they came in touch with.
We're talking about life and death.
Representative Jones says he's just calling out what he sees while still trying to recover from a virus showing no signs of going away soon. According to industry standards, even with the addition of 1,000 tracers in Florida, our state remains some 4,000 tracers short.
Our I-Team just discovering a multi-million-dollar contract to help improve the state's contact tracing program will now cost taxpayers 10 times more than expected. Last month, our Katie LeGrone revealed how the state quietly hired an outside firm to ramp up its tracing efforts. And new tonight, she's learning the pricey new details behind the elusive contract.
Florida's ongoing struggle to slow the spread of COVID-19 through contact tracing is getting far more costly to taxpayers. We've learned what started as a $6 million contract with a Virginia-based company has ballooned to $50 million in just a few months as cases started to spike in the state.
This contract seems really shrouded in secrecy.
Dan Bass with the labor union Communications Workers of America represents workers of Maximus, Inc., the call center provider Florida hired to beef up its roster of contact tracers. In recent years, he says, the government contractor has been accused of underbidding contracts, understaffing jobs, and underperforming projects.
What's the MO here that you're concerned about?
Maximus can try and take advantage of situations to extract extra dollars from states for these important state contracts when the circumstances are right. And this is exactly that type of circumstance.
According to the state contract database, at the end of May, Florida agreed to pay Maximus $6 million over 4 months for contact tracing services to prevent the spread of COVID-19. By mid-July, it extended to a year. Its dollar amount more than quadrupled to $27 million. Less than a month later, the deal is now worth $50 million. But in a company earnings report this month, Maximus touts its 6-month job in Florida at $73 million. Despite numerous requests, Florida's Department of Health has yet to provide us the contract, scope of work details, or answer questions about these rising costs. In an email, a Maximus spokesperson told us it is very typical for contracts to have modifications, such as an extension to take services beyond the initial contract period or changes in staffing. Typically, for volume-driven contracts like this, there tends to be a range of possible financial scenarios that depend on the level of activities. In this case, the total value will likely range between $65 million and $75 million. That may not raise questions if the state revealed more details about its program. and its performance.
I've called it a failure. I've called it abysmal. I've called it ineffective. I've called it the equivalent of not having a program.
Miami Beach Mayor Dan Galber has become an outspoken critic of the state's Department of Health and its contact tracing program after watching COVID cases in his county of Miami-Dade explode.
Are taxpayers getting what they're paying for?
Yeah, I don't know whether we're getting what we're paying for because they're not keeping track of what kind of job they're doing.
The state does tell us they now have 4,400 tracers doing the job. It's unclear how many are Maximus employees or how well it's working. We've asked.
Is this how this is supposed to work?
No, it's not how it's supposed to work. In fact, it flies in the face of Florida's strong transparency laws.
Pam Marsh of Florida's First Amendment Foundation.
They have to provide performance measures so that we can have some accountability of what we are getting for our money. And at this point, it's just all in the dark, not in the sunshine.
But we're all paying for it.
We did ask Maximus about its performance here in Florida. Spokesperson wouldn't say, but did share that any performance data shared by the state would likely include all-encompassing data about the program, not just the company's role.
For months now, our I-team has revealed the daily challenges of the state's contact tracing system. And now with schools about to reopen, the I-team's Katie Legrone tonight is getting answers on how school districts all across the state of Florida are planning to track the cases on campus.
Contact tracing. Experts call it critical to stopping the spread of COVID-19.
We've got to be on it like this.
In Florida, the practice of tracing the virus from person to person has had its challenges.
I still haven't gotten a phone call.
The young lady who called, she wasn't knowledgeable at all.
But with the reopening of schools prompting concerns about case spikes, contact tracing on campus remains a work in progress.
In terms of challenges, it's just another place to go do contact tracing, really.
Pinellas County currently has 100 tracers. While additional hires may be necessary once schools reopen, the process of tracing students will largely be accomplished with adults, according to the county health department.
We would talk to teachers and parents and responsible adults. I mean, we wouldn't do contact tracing with a 6-year-old.
Across the state, 4,400 tracers are now on the job, with some counties ramping up rosters before the school bell rings. Lee County plans to add 78 people to help trace. St. Lucie County is in the process of hiring an additional 20.
It's in combination of school opening in the next several weeks as well as just managing our regular caseload.
Health departments will lead tracing efforts for schools, and while younger patients may pose challenges on the Q&A, health officials fear the lack of rapid results will pose the biggest challenge for tracers trying to contain an outbreak on campus.
The sooner that we are aware of a positive case, the quicker that we can reach out.
But doctors, critical of the state's plan to reopen schools, remain concerned.
The state already doesn't have enough contact tracers in general without a school reopening.
County health departments are using CARES Act funding for these new hires and have until the end of the year to use it. I'm I-team investigator Katie Legrone, taking action for you.